Hello everyone, welcome to fifth video of NEET-PG 2023 recall question discussion. Starting with question number 41. A HIV patient came with this finding, which is the cancer associated. So this is typical presentation of Kaposi sarcoma, the soft tissue sarcoma. This is caused by opportunistic infection HHV8, human herpes virus 8. So what are the malignancy that is caused by HHV8 in HIV positive patient? Number 1 is Kaposi sarcoma, number 2 is primary effusion lymphoma, and number 3 is multicentric Castleman disease. So these are the diseases or malignancy associated with human herpes virus H. So this is typical presentation of Kaposi sarcoma in a HIV positive patient. Coming to question number 42, a chronic smoker patient diagnosed with lung carcinoma. Histopathology shows large pleomorphic cells and hypercalcemia was found on evaluation. So which type of lung cancer is associated with this presentation? So lung carcinoma, usually in case of smoker, the most type of cancer is squamous cell carcinoma, and here hypercalcemia is nothing but paraneoplastic manifestation. So hypercalcemia is paraneoplastic manifestation of squamous cell carcinoma. As you can see here in this chart, squamous cell carcinoma most common paraneoplastic manifestation hypercalcemia because of secretion of PTHRP or parathyroid hormone related peptide. So the answer will be squamous cell carcinoma. And in case of oat cell or small cell carcinoma, common paraneoplastic disease includes SIADH, Lambert-Eaton syndrome, and in case of adenocarcinoma, it is hypertrophic pulmonary osteoarthropathy and Trosso syndrome. So in this case, the answer will be squamous cell carcinoma, hypercalcemia because of PTHRP or parathyroid hormone related peptide. Coming to question number 43, 75-year-old female presented with difficulty in daily activities and social cognition, bradykinesia, rigidity and resting tremor, and on histopathology Lewy body is found. What is the diagnosis? This is absolutely typical presentation of nothing but Parkinson disease. So the answer is Parkinson disease. As all of you know, this is a typical presentation of Parkinson: tremor, resting tremor, rigidity, akinesia or bradykinesia, along with posture, and one special type of gait, short shuffling stepped gait, marked faces, trembling on extremities. These are the typical features of Parkinson disease. So here in this case, the answer will be Parkinson disease. Coming to question number 44, deep inguinal ring is opening in which structure? Here the answer is fossa transversalis. As you can see in this image, anatomical image of inguinal canal. So here lies the deep inguinal ring, also known as internal inguinal. As you can see, this opening is situated in fascia transversalis. Okay, so transversalis fascia, and this is superficial inguinal that is present in external oblique muscle, also known as external ring. So the answer in this case, a deep inguinal ring or internal inguinal ring, is situated in fascia transversalis. Next, coming to question number 45, varicose vein along with eczema. What is the CEP category of this classification? As all of you know, CEP means clinical, etiological, anatomical, pathophysiological classification of varicose vein. The most important classification details to remember for competitive exam. Number 1 is only varicose is C2, C3 is edema, C4A is pigmentation or eczema, and here the question asked about the pigmentation or eczema, and C4B is also important for competitive exam, that is lipodermatosclerosis. Usually these 4 question is asked in competitive exam, and sometimes healed venous ulcer, active venous ulcer asked. So in this case, the answer will be C4A. Most important point to be remember, C4A and C4B. This is repeatedly asked in previous examination also. So in this case, eczema will be category C4A. Coming to question number 46, 50-year-old male, chronic smoker, patients with weight loss, shooting pain in the right upper limb and ptosis. In this case, as you can see in this image, there is some opacification of right upper lobe. This is nothing but right upper lobe tumor, also known as Pankos tumor. And Pankos tumor, and how Pankos tumor is associated with all of these findings, as it is a tumor or malignancy. It is associated with weight loss. The shooting pain in the right upper limb is explained by compression of lower trunk of brachial plexus, and the ptosis is explained by nothing but Horner syndrome because of compression of cervical sympathetic ganglion by the Pankos tumor. So thus Pankos tumor explain all the symptom in this patient. Also the patient is smoker, more prone to develop cancer. So this is nothing but Pankos tumor or right upper sulcus tumor of the lung. Next, coming to question number 47, patient from West Rajasthan presented with ulcer and rolled edges. Microscopy show kinetoblast. So this is nothing but Leishmania tropica. In case of Leishmania tropica, you will see kinetoblast in microscopy, and this is this is tropical ulcer caused by Leishmania tropica. This is not basal cell carcinoma. In case of basal cell carcinoma, you will not see any kind of this find like kinetoblast. Coming to question number 48, this microscopic image or histology image shows what? Are you thinking this is islets of Langerhans? Definitely no. This is the wrong answer. So what is the answer? This is it hemangioma? No, this is not also hemangioma. What is the answer? This is glomerulus. You can see here presence of multiple glomerulus. So these are the glomerulus, and this is the tubular cells, tubular structures. So this is histological picture of glomerulus. Coming to question number 49, elderly male, hepatitis B positive, kidney biopsy shows spike and dome pattern. What is the diagnosis? So spike and dome pattern in kidney biopsy immunofluorescence is suggestive of what? Yes, it is membranous glomerulonephritis or MGN. So as all of you know, there are various causes of MGN. It may be primary or it may be secondary. Primary is caused because of some antibody like antiphospholipase A2, or secondary is associated with some infection like malaria, then hepatitis B, hepatitis C, or any kind of malignancy, lymphoma, or some drugs like gold, etc. So this is typical case of membranous glomerulonephritis, where spike and dome pattern is seen in kidney biopsy immunofluorescence, and hepatitis B causes secondary MGN. Hepatitis B causes secondary MGN. So membranous glomerulonephritis is the answer. Breast carcinoma with good prognostic factor. ER positive, yes, it is definitely good prognostic factor. Ki-67. Ki-67 is the proliferating index for breast carcinoma. Higher the Ki-67 value, more the worse prognosis of the patient. So this is not Ki-67 was a good prognosis. BRCA1 positive, BRCA1 mutation is associated with triple negative breast carcinoma, and as all of you know, triple negative breast carcinoma is very dangerous, worse prognosis. So this is also wrong, and P53 mutation is also wrong option. So the best prognosis for breast carcinoma among the 4 option is ER positive. So in the next video I am going to discuss question number 51 to 60. Stay tuned for the next video and don't forget to subscribe my channel. Thank you.